The Lachman Test is a diagnostic tool used to evaluate the anterior cruciate ligament's stability in the knee joint. A healthcare professional performs it like an orthopedic surgeon or physical therapist. It involves the manipulation of the tibia bone while the knee is flexed at a 20 to 30 degree angle. During the test, the examiner stabilizes the femur bone with one hand while pulling the tibia forward with the other. The amount of forward movement is then compared to the opposite unaffected knee. If the ACL is intact, the tibia should have minimal forward movement. If the ACL is torn or damaged, there will be abnormal movement. Research has shown that the Lachman Test is one of the most reliable and accurate tests for diagnosing ACL injuries, with a reported sensitivity of 85 to 100% and specificity of 85 to 98%. However, the accuracy of the test can be affected by factors such as skill and experience of the examiner, the patient's muscle relaxation and joint position, and the severity of the injury. ACL tests like the Lachman Test are used following a knee injury, pre-operative assessment, follow-up evaluations, and athletic clearance. The Lachman Test is a valuable resource for healthcare professionals who evaluate and manage knee injuries. The following can find value in our resource: orthopedic surgeons, sports medicine physicians, physical therapists, and athletic trainers. To use our free Lachman Test, follow these steps. Download our Lachman Test from the Carepatron platform, which you can find in the link in the description. Have the patient lie down. The patient should lie flat on their back with their knee bent to a 20 to 30 degree angle. Stabilize the femur bone. The examiner should use one hand to stabilize the femur bone while the other manipulates the tibia bone. Assess the amount of anterior translation. The examiner should gently pull the tibia bone forward to assess the amount of anterior translation or forward movement. This movement should be compared to the opposite unaffected knee. Record the results. The amount of anterior translation should be recorded and compared to average values for the patient's age and gender. Lastly, interpret the results. The results of the Lachman Test can indicate the presence of an ACL injury with abnormal anterior translation suggesting a tear or damage to the ligament. The Lachman Test is typically scored on a scale from 0 to 3, with 0 indicating a typical result and 3 indicating a complete anterior cruciate ligament rupture. Here is a sample of our Lachman Test, which you can find on our Carepatron platform. To find our Lachman Test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.